Hi, my name is Gretchen McNally. I am working with Sam Jaglowski, and I'm going to try to talk to you today about Canada. So Canada is the second largest country in the world. It makes up almost 1 million square kilometers. And it really is the largest area of fresh water in the world across the globe. There's over 2 million lakes. It's made up of 10 provinces and 3 territories, almost if you think of like the United States and states. So Native Canadians, also called First Nations people, previously known as Indians, Eskimos, Aboriginals. This indigenous population lives primarily in like the northern areas in the Arctic, where it's very rural, and they face a lot of inequities leading to health disparities in life, like overall mortality, infant mortality, food insecurity. And there's approximately 1.8 million Native Canadians, or about 5 to 6% of the total population. So back in the 16th century, the French and British expeditions arrived. And as you can see, Canada was really controlled by Britain until 1931, when they became an independent nation. And for that reason, about 70% of the population is white. 1 in 4 are non-white. Many of those are of Southeast Asian descent, 7.1%, or 2.6 million. People of color, Black, Latinx, make up a smaller percentage of the population. So Canada has a publicly funded healthcare system called Medicare, and it's not like a national plan because it's managed by all the individual provinces and territories as their own healthcare insurance. So there is variation that exists. But basically, it says that all Canadian residents, have reasonable access to medically necessary care. Residents are covered when they travel like within Canada, regardless of what province they're in. And there is some limited coverage when they go outside of the country. So what Medicare says is that people can access medically necessary services regardless of their ability to pay. Primary health care is like the first point of contact, and they really coordinate the rest of the care to specialists or hospitalists. And then supplemental coverage can be obtained to help pay for other things, vision, dental, medications, that type of thing. So universal access does not mean equal utilization, and much like the United States and other countries, Canada experiences a lot of inequities. Basically, when compared to the US, there's similar utilization rates for people with higher income education levels, so higher socioeconomic status, and people of lower income, lower education, they have higher rates of healthcare utilization. However, it's important to recognize when you're just looking at Canada itself, these lower socioeconomic status populations actually have less utilization than other populations. So, we mentioned Medicare is the universal health insurance system, but the private insurance market does exist, and private insurance can be purchased to cover things that are not covered by Medicare. And about 90% of private health insurance plans are paid for by an employer. So right here we can see where if you're not working or not able to work, or if you're, if your job maybe is a lower, pays less, has fewer benefits, that you may not have as good private insurance or any private insurance as someone who makes more money or maybe has more education and has a different level of employment. So Medicare accounts for the majority of healthcare utilization, about 71%. And so there's no direct financial barriers to accessing care. But really, it's the services that are outside of Medicare that create issues of equity. Because in order to be able to obtain those services, you need most likely to have like private insurance or to be wealthy, and we know not everyone is. Perello et al. Did a really nice study that came out in 2022. They looked at 3 different measures of healthcare: general providers, like primary care providers, specialists, and then hospital admissions. And they showed that regardless if it was in a rural area or an urban area, that there was pro-rich inequity in all 3 areas. And what that means is that people of higher socioeconomic status had higher or better utilization of general providers and specialists, and there was less hospital rates or decreased hospital admissions. And they showed that the presence of barriers to use, it wasn't related to the direct, it wasn't directly related to the cost of the services, because Medicare covers that, but it's those indirect costs, time away from work. I can't take sick time, or I don't have sick time, and I can't afford to miss that time working, that money. Childcare, elder care, transportation. Maybe I don't have a car or another way to get from, here to there. Or if, if it's rural and it's a long distance away. Some psychosocial considerations that were also important to consider. A lot of people have a lack of trust of the healthcare system, maybe because of a history of a negative experience. I know that for me, as a healthcare provider, I have many patients that just are not able to manage the complexities of the American healthcare system. I'm sure Canada system is not much different. So unfamiliarity with the Canadian healthcare system makes it challenging to access care. So we know that certain populations in Canada, they really focus on the first Canadians as their primary population of interest for improving disparities and inequities, although there certainly are other groups. And Canada started this Canadian Quality and Patient Safety Framework back in 2020. And they basically recognized that there was inconsistent care between certain groups, based maybe on age, people that are older, gender, people of different races and ethnicities, diverse populations, those individuals who identify as LGBTQ, are people of color. And so Canada launched this initiative in October 2020, really to align and improve the quality and safety nationwide, so there really wasn't as much variation between the groups. So we talked on the last slide how some groups are not treated equally, that disparities and inequities do exist in Canada for some populations. And So while there are a lot of challenges in Canada that we see, across the globe, the healthcare worker shortage, issues of access to treatment, waiting times, aging population, I also think that geography contributes to the challenges that Canada experiences, just because it's just so big, and that makes it really hard if you're in a more rural area to get access to the care that you need. Future directions, worldwide, really innovation and advances in technology are driving future trends. And while this will expand health, access to health services, especially in rural and remote areas where maybe telehealth would be better than driving 3 or 6 hours, I always worry about the people that lack the technology. What if they can't afford the technology? Or maybe they're so rural, they just don't have the technology. It really makes me wonder or worry when I think about like COVID-19 and the inequities that came from people moving to virtual education, and then kids not having access to the internet, but either because they were too poor to afford it, or they were just so rural or isolated it didn't go there. So I do worry about that. These are some of our sources, and this was great. Thank you so much for a great semester.